of the PDG is very significant and an exciting opportunity for childcare providers in Kansas. And we got to this approach because Thrive Allen County has actually done this before and they have experience. They actually, through previous PDG funding a few years ago, created a model to really say we know that health insurance can be a really significant barrier, as a lot of childcare professionals don't necessarily have access to health insurance through their employers. And so they tested a model in their community to say, like, what happens if we provide some reimbursement and some funding to support that. And so we are basically taking the model that they've done and looking at it across the state, and also using some leverages or using some resources they've developed to help providers understand the health insurance marketplace throughout the state of Kansas. So the reason for this, and I know this is like probably not what you want to hear about the resources, so we're going to get to that. But we are at the state level really looking at uh, what are things we can do to look at workforce retention for childcare providers. And I think this is a strategy we think is very much worth investing in and seeing, if we're equipping childcare professionals with benefits that they deserve to have, what is the impact of that on their quality and how they feel about remaining in the childcare field. So that's just a little bit of like background context for how we got here in Kansas and kind of why this is a focus area for the next 3 years. So I'm going to hand it to Jessica Thompson and Rhonda Culp from Thrive Allen County, and they will share more about the resources that will be rolled out to Kansas childcare providers very soon.
I am Rhonda Cope. I am the Director of Care Coordination.
And I'm Jessica Thompson. I am the Deputy Director here at Thrive Allen County. Just a little bit of history about this program. So in 2019, 2020, we held conversations with child care providers here in Allen County, asking them what the biggest barriers to being a child care provider or recruiting child care providers were. And two things came up. The first was funding to pay for first aid classes, TB tests, things like that every child care provider has to have, but that add up very quickly when you have high turnover rates. The second was health insurance. When, according to the child care providers that we talked to, they were already making low pay, and the child care facilities that they worked at didn't offer health insurance. Or as a child care provider, individual child care provider, they couldn't afford health insurance. And so we came up with a stipend program that we piloted in Allen County. And in that stipend program, we reimbursed $300 a month per month for 3 years to child care providers in Allen County that had insurance or wanted to get insurance. It didn't cover all the costs sometimes. Most of the time it did, but sometimes it didn't, but it did help offset those costs in a great way. And so we were approached by the Children's Cabinet this past year to take that pilot program and pilot it throughout the state of Kansas, which is what we will talk about later on in this presentation. But for those of you who don't know, Thrive Allen County is a health, wellness, and economic development organization located in Allen County. We Our goal is to make Allen County the healthiest county, rural county in Kansas. And we do that by working on social determinants of health. So that isn't just, going to the doctor and getting your medicine and taking your medicine. It's, do you have transportation to get to the doctor? Do you have a good job that provides health insurance so you can go to the doctor? Do you have a safe home to go to at the end of the day? All of those things. And we've taken that model and we've created Thrive Kansas in 2017. And Thrive Kansas does what we do in Allen County at a statewide level. We look at social determinants of health. We work with communities throughout the state to implement programs and initiatives that will increase the health, wellness, and community of that individual community or the communities surrounding it. And so we've worked really hard these last 17 years as Thrive Allen County, and we've seen growth and progress. One thing that we're really proud of is our insurance rate in Allen County has dropped from 21% in 2013 to 8% in 2018, and is right about 10% right now. Sorry, my voice is going out. And so, we look at programs that impact the health and wellness and community development of our local county as well as statewide. And through that, we pilot programs like this to provide benefits that make Kansas healthier, that make Kansas better. We were awarded a 5-year grant this past year through CMS called the Navigator Grant. And that helps us enroll people in marketplace insurance, Medicaid, and Medicare. And so that's what Rhonda is going to talk to you about now, is that program and how we can work with you on getting insurance. Next slide.
Okay, like Jessica said, I'm just going to talk to you guys, give you a little history about what is marketplace insurance. Of course, marketplace insurance is provided through the Affordable Care Act, or the ACA, which just offers health coverage options for individuals, families, and small businesses. The marketplace operates on 2 different types of platforms: a state-based platform for insurance options or a federal-based platform for insurance options through healthcare.gov. Kansas operates on that federal platform. The subsidies and cost assistance that provides that financial help for people who enroll are the premium tax credits and the cost sharing reductions that are available based on your income and household size after you guys have completed an application. All the plans in the marketplace offer comprehensive coverage, so they all have to include coverage for doctor visits, hospital stays, prescription drugs, and preventative services. The enrollment period, coverage is available during the annual open enrollment period, which it used to be back when we ran our pilot program. Open enrollment ended on December 15th, but for the last 3 years, they have extended open enrollment till January 15th. So for those of you that still don't have coverage and that are interested in coverage, you still have availability until January 15th to look at those options. Just if you are enrolling from between now and January 15th, of course, your coverage ain't going to start until February 1st. They also have the special enrollment periods that can be triggered by qualifying life events such as job loss, you get married, have a child, whatever the case may be, where we can also look to see if you're available to enroll. Next slide. And like I said before, the healthcare.gov platform can compare different health insurance plans. You can compare up to 3 plans at once to see which is going to give you the best affordable coverage, and it's going to be based off your needs and budget. So we as navigators, we don't try to sell you anything. We're strictly just trying to help you find the best coverage possible based on your situation. It does cover pre-existing. That is a question that's asked a lot, is somebody who might be diabetic who ain't been eligible for coverage through private sector will come in and say, well, I can't get coverage through the marketplace because I have this condition. And yes, you can, because the marketplace does not look at pre-existing. Next slide. And like I said, it also offers an eligibility check. So for those that are not sure what they will qualify or what their tax credit or cost sharing may or may not be, we can always do an eligibility check before you even fill out an application to healthcare.gov. So we can check it based off your zip code, your income level, and your family size, and it will give us an estimate of what those tax credits and cost sharings are going to look like for you. Like I said, pre-existing and essential health benefits are all covered on each plan. Every plan in the marketplace covers it and has to offer those essential benefits. And then again, the open enrollment period has been extended to January 15th, and that coverage, though, does not start until February 1st. Next slide. Navigators and their roles. So now, Dry Island County, under the Kansas Cares Project that Jessica kind of talked to you about, under our Thrive Kansas umbrella, has navigators available to assist you with enrollment in the federal marketplace. We have partners throughout the state of Kansas that can help you with that. We have both English and Spanish-speaking navigators through those partners. The services that the navigators offer to you are free and unbiased, whereas if you were to go to an agent does have the right to charge you for those appointments. And sometimes they're not always got your best interest at heart. They're generally trying to sell you something, or they're trying to sell you a certain plan based off what plans they have contracted with. Navigators strictly just have what's best for you at heart, and they can educate and explain the different plans to you, because we hold a meeting every October with the different MCOs with the plans in the marketplace, and they kind of give us a lowdown of what the plans are, what's going to be available, and then we can pass that information on as we're helping consumers enroll. Next slide. So navigator assistance is available both in person, via Zoom or phone. We can help you guys anyway. The consumers can visit our kansascares.org website that was developed 2 years ago. If you go to that website, it will pop up a little chat bot, and then it'll also have 3 things in the middle. It'll say find a navigator, find a BSP, or resources. If you clicked on find a navigator, you can look based off your zip code as to where the closest navigator is to you, and it's going to give you the navigator name, the organization that they're with, their phone and email address. And then the chatbot just offers consumers a chance to ask them frequently asked questions, like, is my income level going to qualify for me for tax credits? And then I'll ask you some more little detailed questions like, what is your annual income? What's your household size? And then, yes, it will populate whether you're going to be eligible for tax credits and should move on to the next step to contact the navigator. Next slide. So navigator appointments approximately take about an hour, whether you're meeting with them in person, via Zoom, or on the phone. I tell all of my consumers when we come, make sure you have the Social Security numbers, date of birth of all your household members with you when you come, and also bring your tax return, because that is what we use for income proof We can use the tax returns and pay stubs, because everybody's income can look different. Not everybody's income is strictly based off pay stubs. Some people's income is based off Social Security, retirement plans, annuities, whatever the case may be. So if they bring in those tax returns, we can look at that adjusted gross income from the previous year to kind of estimate for the next year what you think your income is going to be, so that we make sure we're getting you the best tax credit we can give you. Next slide. Any questions? Okay.
If not, we will move on to the insurance stipend program. As I said before, this was a project that was piloted in Allen County that Children's Cabinet approached us about doing statewide. And so just some information about the stipend program. This will be administered by Thrive Allen County on behalf of the Children's Cabinet. So all your checks, if you were to be accepted into this program, would come from Thrive Allen County. It will be reimbursed up to $300 per month for paid insurance premiums. There will be 3 disbursements for those reimbursements. All health insurance plans are eligible for reimbursement. This includes family, spouse, individual, marketplace insurance, private insurance. If you have insurance through your spouse, that also counts. So it's any and all health insurance plans that you have a premium for. We will accept approximately 100 individuals for this program, and the eligibility dates might change a little bit. This is based off of when our contract starts. So this could change to January 2024 to September 2025. But we will let you know when the applications are released, what those dates are specifically that we will be able to reimburse for. Next slide. So the requirements to apply for this: you must be a Kansas resident, and you must be employed at a child care facility located in Kansas. You cannot live on the border and work in Oklahoma, Missouri, Nebraska, Colorado as a child care provider and qualify for this program. You can be enrolled in marketplace insurance or private health insurance, and you must have premiums that you are currently paying out of pocket or that you will pay out of pocket if you currently don't have insurance but want to sign up for some. And then you must work as a provider or educator at that child care facility that you work at. Next slide. Preference will be given to child care providers earning less than $45,000 per year. Child care providers who are currently without insurance, and home care providers. If you do not meet one of these qualifications, that is okay. I would encourage you to still go ahead and apply for this program. It's just that if you make $50,000 or $55,000 a year and somebody makes $30,000 a year and we have one slot left open, that person will be given, the one making $30,000 a year will be given preference over the one making $50,000 to $55,000 a year.
I have a question.
Okay.
Does that mean, is that gross or after deductions?
That's gross.
Okay, thank you.
Yeah. Next slide. So the application process, there are certain things that you'll need to submit when you apply for this program and certain things that you'll need to submit each time you get reimbursed. So the original application process includes an application, proof of employment, which is an FTE attestation, proof of insurance, and then your most recent insurance statement. That all has to happen with the original application when you first apply. You need to turn in all of those things. When you get reimbursed after that, you will need to do the proof of employment, the proof of insurance, and then the most recent insurance statements. You just don't need to do the application again, but you'll need to do those to show that you are still employed at a childcare facility and that you do currently have health insurance that you're paying premiums on. Next slide. These are important dates for you to know. January 1st, the application opens. January 15th is when the application closes. The first disbursement for the first set of premiums, which will either be October 2024 through February 2025 or January 2024 through February 2020, or January 2025 through February 2025 will be mid-March. After that, April 15th and July 15th will be when paperwork is due for those reimbursements. For the next disbursements, that will happen in mid-May and mid-August. Sorry, that should say mid-August. No, mid-September, that's right. Mid-September when you'll get reimbursed for those. Next slide. Now, in addition to this, we have provided a dedicated care coordinator that works here at Thrive to help you with assistance. So this could be helping you to enroll in the marketplace insurance. This could be helping you to discuss how the stipend might impact your tax credits or your cost sharing if you have marketplace insurance, or if you're going to get marketplace insurance. She can also help you enroll in other government assistance programs. So food assistance, rental assistance, stipends, utility assistance, stipends for childcare providers that are available through the state. She can help you with all of that. Your contact for that is going to be Greta Engel. She is the Thrive Allen County Lead Care Coordinator, and her phone number and address or email address are up on the screen. She is available, as well as any of our care coordinators and navigators are available to assist you with this, but she is dedicated to this program. And so she should be able to help you navigate through all those programs and tax credits and cost sharing and questions that you may have about how the stipend may impact various things that you may qualify for. Next slide. So this is Rhonda's and my contact information. I saw that we had some questions come up. So the first question is, since October 2024 has passed, I assume the application will be available January 1st, 2025 through September 2025, correct? The application will be available January 1st, 2025 through February 15th, 2025. If you qualify for reimbursements and we are able to do the October, we will backdate those. If we are not able to do October, we will backdate up to the date that we are able to do through our contract, and then reimburse through that, reimburse up to those dates. Those who are accepted those who are accepted through the program are qualified for the entire up to September 2025. So you don't have to reapply for the program once you've been accepted into it for this year. The next question is, childcare staff could apply, but priority given to FCC providers, correct? That is correct. Childcare staff are more than welcome to apply for this position or for these stipends. But we have to meet a certain criteria of number of home care providers that we provide these stipends to. And so they will be given priority in certain aspects.
I think those are the only questions that were in the chat. I also added that Jessica and Rhonda and their team is working on a one-pager. So we will follow up with everybody on this call. We've got your emails and send you the one-pager once we have it, and then just confirmation of those eligible dates. But like Jessica said, the January 1st application date is the same. It's really just the reimbursement period. So more to come. I know this is a lot of information. I'll also just note, I don't think this is going to be a surprise to anybody that we anticipate this being a well-utilized resource. And so would definitely recommend you promote this as quickly as possible with any childcare providers that you know, and make sure they're aware of it. But we will get some materials that you can share in an easy format out shortly. Are there any other questions?
Yeah, sorry.
No problem.
I know that this information is a lot, and that that you might have questions come up after we get off this call. If you do, you're more than welcome to contact me, and I'll answer your questions. I know the big question right now is going to be, will it be October or January that these reimbursements start? And unfortunately, we just don't have that answer right now because it's all dependent on when our contract starts. So we have to talk with Children's Cabinet and see when that will begin. All right, we zipped right through this, guys. I appreciate you sitting with us and learning about Marketplace Insurance and about the insurance stipend program. Like I said, we're available. Greta's available, Rhonda's available, I'm available for questions that you might have about Marketplace Insurance or about the stipend program. But thank you so much for coming, and we look forward to getting applications in. I would get them in sooner rather than later, as soon as the application opens, because it's another criteria will be when those applications are received. And so the sooner we get them, the better.
The one final call for any questions. Okay. Again, thank you all. As Jessica said, thank you for your time. We will get materials out to you soon so that you know exactly what to share with any childcare providers or how to apply yourself if you are a childcare provider. I just want to say thank you to Jessica and Rhonda and their team at Thrive Allen County. This is an incredible resource to be able to expand in Kansas. And I think, we'd love to just see how, or we're excited to see how it goes and what the impact is on our childcare workforce. We know this is a big need and appreciate their team's work on getting it rolled out. Thank you all. Happy holidays.